could the leader just address Connolly first and not contrary to his 5 minutes?
Absolutely.
Just ask me.
Absolutely.
So let's start with that and then do.
Mr. Jeffries, I understand you want to address the group in terms of the loss of Mr. Connolly first, and then I'll identify you for your testimony.
Well, Madam Chair, thank you so much, and thank you so much for the moment of silence and the kind words of remembrance on behalf of our dear colleague, Jerry Connolly, who really was a member's member, someone who conducted himself with the highest degree of intellect, brilliance, resilience, integrity, humor, and wit. It's a great loss for his family, great loss for his district, great loss for the Commonwealth of Virginia, great loss for us as House Democrats, but certainly a great loss for the Congress and for the country, given just the depth of his representation, the relationships that he had on both sides of the aisle, on both sides of the Capitol, and the fierce representation that he provided to the people that he's been privileged to represent for decades. Thank you for giving me the opportunity to share some brief words of reflection on behalf of the House Democratic Caucus.
Well, I'm reminded of an old poem, "For Whom the Bell Tolls."
Thank you, Madam Chair.
Thank you, Mr. Jeffries. Now, I'd like to recognize that we have Minority Leader Jeffries, Leader Clark, and part of the leadership, Mr. Aguilar, at the witness table for our first panel. So I now will recognize each of you. Will you be going first, Mr. Jeffries?
Thank you, Madam Chair. Good morning. Thank you, Chairwoman Fox and Ranking Member McGovern, for the opportunity to testify at this incredibly important Rules Committee meeting. I also thank my colleagues, Whip Catherine Clark and Caucus Chair Pete Aguilar, for partnering with me on this amendment. Come before you today with an amendment to strike the unacceptable, unconscionable, and un-American cuts to the health care and food assistance of the American people. America is the wealthiest country in the history of the world. We are better than this. The great American middle-class dream is that when you work hard and play by the rules, you should have the ability to provide a comfortable life for yourself and for your family, a good paying job, educate your children, purchase a home, and have access to high quality and affordable health care, as well as be able to put food on your kitchen or dining room table. Unfortunately, we are here today discussing a bill that would make that American dream harder to reach for millions by increasing costs for families, hardworking American families, and gutting the things that they need to survive and thrive. This reckless budget would take health care and food assistance away from millions of people in order to provide tax cuts to the wealthy, the well-off, and the well-connected. It would hurt children, hurt seniors, hurt families, hurt women, hurt people with disabilities, and hurt our nation's veterans. If enacted, the GOP tax scam would represent the largest cut to health care in American history and the largest cut to nutritional assistance in American history in order to provide the largest tax breaks to billionaires like Elon Musk in American history. So let's begin with the health care component of this amendment. Everyone should have access to high quality and affordable health care in the United States of America. In 1965, Congress created both Medicare and Medicaid. In the intervening decades, Congress passed legislation to expand and strengthen these important programs. In 2010, this Congress, under the leadership of Speaker Nancy D'Alessandro Pelosi, passed the historic Affordable Care Act, which created new protections for people with pre-existing conditions and expanded health care for tens of millions of people who couldn't otherwise afford it. Since then, we have managed to achieve the lowest uninsured rate in history. Why would we go backward? Which is what the GOP tax scam would do. We know, however, that our healthcare system is not perfect. Too many Americans continue to be unable to pay their medical bills and struggle to get access to the care that they need. As Democrats, we are ready to work in a bipartisan manner to address these challenges, but we will never support any Republican effort to rip away health care from the American people. This GOP tax scam will force nearly 14 million people to lose their health coverage and cause millions more to pay higher copays, premiums, and deductibles. Hospitals will close, nursing homes will shut down, and people will die in all of your districts. Now, prior to the modern SNAP program being created in 1964, there was vast hunger and food insecurity across this country, including in low-income communities, rural areas, and communities of color. Thanks to public investigations, community-based organizations, and some good journalism, these challenges were spotlighted, and the need for an expansion of federal food assistance was highlighted. The American people were moved by images of children with distended bellies rummaging around in garbage and families going hungry. It finally compelled Congress to act. And over the last 60 years, we as a country have made significant progress to reduce hunger and help people afford nutritional food. Unfortunately, the policies in this GOP tax scam threaten to undo this progress and return us to an age where far too many children or veterans or seniors are struggling to eat and get access to the nutrition that they need. It's also important to recognize that SNAP is a vital part of providing opportunity for our farmers, who we stand with, food makers, small businesses, truckers, independent grocers, and the entire supply chain. So for the Republicans who have promised to love and cherish Medicaid, I ask you to support this amendment. For the Republicans who believe we should not rip food away from the mouths of children, seniors, and veterans, we ask you to support this amendment. And for the Republicans who believe that the gospel in Matthew 25 and 35 teaches us to stand up for the poor, the sick, the afflicted, the least, the lost, and the left behind, we ask you to support this amendment and strike these harmful cuts to health care and nutritional assistance. Thank you, Madam Chair. I yield back.